Thank you so much, President Bachara. We are so grateful to partner with Kaiser to do this very impactful work. Next, we will hear from Dr. Jonathan Patz, Inaugural Director of the Global Health Institute at the University of Wisconsin-Madison. Dr. Patz is the Vilas Distinguished Achievement Professor and the John P. Holton Chair of Health and the Environment, with appointments in the Nelson Institute for Environmental Studies and the Department of Population Health Sciences. Welcome, Dr. Patz.
Hello, everyone. Thank you for allowing me to present by video. And apologize, I can't be in Washington. I'm still on sabbatical in Australia. So let me get started by sharing my screen. I'm going to be talking about the climate change impacts on human health and equity. And of course, when we talk about climate change, there are three narratives. One is that the climate crisis is a human health emergency, and there are many vulnerabilities and pathways through which climate affects our health. There are disproportional and intergenerational impacts, so there's injustice in this situation, but there's a message of hope that the larger the crisis, the larger the opportunity. And just to contextualize and look at the aspects of this issue in its entirety, consider fossil fuel combustion that leads to greenhouse gases that are causing climate change and the physical attributes of climate change that affect our health through so many different ways. And all of you in this room are well aware of this. And of course, we need to think about prevention, and where there's issues as far as increased resilience and adaptation to reduce the risk at this end. But we also want to go to the root of the problem and talk about primary prevention. And we need both primary prevention, reducing emissions, and also build resistance and resilience to the issue. And we need to build public awareness, movements, and promote climate justice to get these interventions going. Mind you that this entire flow chart is the organization of our textbook that was released last month. So all of these elements are chapters within Climate Change and Public Health, the second edition release at the end of, or the beginning of March. So you can go to that as a reference after this presentation. Now let's just start from the beginning, direct effects of heat. We know about the urban heat island over concrete buildings and asphalt roads. It gets very hot in urban centers. But there's an equity story here. We all know about the redlining that happened many decades ago, that if you were African American, you were forced to buy a house only in undesirable locations, these redlined zoned areas. But look where we put investment in green parks and green space, not in the redline areas. So look at temperature. This is a heat wave this is Richmond, Virginia, and you can see the red line areas heat up as the hottest areas for the urban heat island. So this is not fair. Also regarding heat exposure, there are workers that are exposed to heat and have adverse effects. This is a new study out of India showing that women, outdoor workers, have an adverse effect from heat with the heat exposure in women leads to a doubling in the risk of miscarriage and any adverse pregnancy outcome because of exposure to heat. So this is a new study that comes out, new risk from heat. Of course, we know that climate change is more than just about temperature. It's also about extremes of the water cycle. This is a map showing extreme flooding and rainfall, and I've highlighted my state of Wisconsin, where we're seeing much more rainfall. You can see in the left all sorts of health outcomes related to flooding and excessive rain. In particular, we're worried about contamination. We actually did a study looking at rainfall in our region, and you can see at base flow, very little contamination of E. coli in the waterways. Heavier rain, more contamination. And if you have a combined sewage overflow, a CSO, combined sewage overflow event, you see much more E. coli. And we modeled that in the future, because of heavier rainfall from climate change, the city of Chicago could see a doubling in these events of combined sewage overflow events where the sewage system just cannot handle both the sewage intake and the rainfall runoff. So you have overflow into surface lakes and streams. That's a problem. But during these floods, you don't see diarrheal diseases, people with diarrhea coming into the ER. You see asthmatics. So look at this picture, flooded basement after a storm, and it's no surprise that you see asthma admissions after big flood events. Again, this is an equity story because our race has passed, flooded future. It's the formerly red-zoned, red-lined areas that are neighborhoods in low-quality floodplains that are at highest risk. So both the heat waves and flooding are equity aspects, major equity problems that we need to grapple with. Thinking of newer risks, there's certainly more attention to wildfires. In the Western United States, we see 2 to 3 weeks less snowpack at the end of the summer than 50 years ago. So we're having many more fires. This is the cover of Nature, smoke, wildfire smoke and health, major issue. And there are vulnerable groups, especially children. This is a study that shows that the wildfire particulate matter is 10 times more harmful to children than other types of fine particulate pollution. So that's a risk factor, especially in children. And here in Australia, a cohort study in New South Wales, Eastern Australia, found that wildfire smoke leads to preterm birth and low birth weight, which of course is associated with all sorts of adverse health effects. Another risk from climate change, of course, are insect-borne diseases, vector-borne diseases. Obviously, a cold-blooded mosquito like Aedes aegypti here on the screen is more sensitive to subtle changes in temperature than us mammals, where we maintain our body temperature. The air temperature dictates the body temperature of that mosquito, and this mosquito carries yellow fever, dengue fever, and Zika virus. Right before the major Zika epidemic that erupted in Brazil and Colombia and throughout Latin America a few years back, that was preceded by one of the strongest El Niños in our recent history. We plotted the temperatures. My colleague Dan Beaumont in the Climatic Research Center at Wisconsin found that the temperatures right before Zika erupted were more than 2 standard deviations above a constructed 60-year average temperature. So, and again, this is an equity story because when you look at this this Brazilian slum called a favela compared to the high rise next to it, who's going to be more exposed to disease carrying mosquitoes? And during that heat wave, the vectorial capacity of that mosquito species, Aedes aegypti, was at its highest level in the past 60 years. So we, of course, importation, travel had something to do with Zika arriving in South America. But open question still is that did that extreme heat have something to do with having Zika just take off? And you can see who's going to be at more risk. We were one of the first to look at the ethical impact of climate change on global health. We plotted the diseases that are climate sensitive, for example, malaria, malnutrition, and diarrheal disease. You can see these are climate sensitive diseases that show up and where are they most prevalent in these poor countries in sub-Saharan Africa, India. But who's the most responsible for pumping out greenhouse gases? Well, over a 50-year aggregate, the United States is number one. You can see the EU is up there. China is now out polluting us, but is a in an aggregate, when you look at who's responsible for today's climate change, it's the United States. And in fact, per person, Americans emit 6 times more CO2 than the average global citizen. So we are a guilty party to this problem. So here is a global equity challenge. Those most at risk are the least responsible for causing the problem. And we're seeing this play out in real time. Just a couple of years ago, when you saw massive flooding in Pakistan, and you see, this is, again, sort of echoing our original cartograms, again, that those most at risk are the least responsible. The equity or inequity in this challenge. But I look at climate change as an opportunity when you think about the solutions. They're great solutions. Solving the global climate crisis could be the greatest health opportunity of our times, a low carbon future, improving global health and achieving economic benefits, and climate solutions double as health interventions. And again, the larger the crisis, the greater the opportunity. We all know that burning fossil fuels heats up the planet, but also leads to air pollution. And the latest study amongst air pollution epidemiologists, published in November last year, shows that 8 million people die prematurely every year. And of those, over 5 million premature deaths are directly tied to burning fossil fuels. Our food sector, our resource and energy intensive diets, especially way too much red meat in wealthy countries, is killing us through heart attacks and strokes, and also a huge environmental footprint on the planet, thinking about all the water and the crops to feed livestock and the fossil fuels that go into that. So if the world, according to this Lancet Commission report, if the world adopted a universal healthy reference diet, a plant-forward diet, much less red meat, unless you're in a poor, arid country where you really need that kind of nutrition. But this type of diet would save 11 million lives every year. And the other sector I want to talk about is transportation. We've designed cities that are unhealthy for the reason that we're over-reliant on the private vehicle, motorized vehicle, and that active transportation from biking and walking offers health benefits, like almost 4 million deaths avoided. So golden opportunity to get to low carbon and save lives when we think about these 3 sectors. And the National Academy of Sciences report that came out in October had a chapter on public health co-benefits when you look at decarbonizing the economy. So this is really important, a golden opportunity. We need to communicate the fact that there is a positive message when you talk about climate change. It's a golden opportunity to decarbonize and improve our health in the meantime. But when we think about equity, and you see a map here of coal-fired power plants and where you see the most impact from our energy location of these power plants, keep in mind that historically the placement of power plants in large industries disproportionately harmed Black, Indigenous, and low-income communities. So when we think about getting to low carbon and we look at solutions, we need to be thinking about equity as well and making sure that those disadvantaged communities also benefit as we transition and have a just transition into a low carbon economy. My group's been looking at this, looking at how the air quality would improve if we were to decarbonize across sectors. And the headline, of course, from our study is that cutting air pollution from fossil fuels could save more than 50,000 lives every year. Our result was 53,000 lives every year could be saved, and $600 billion in mortality and health costs would be saved. So depends where you live, the types of sector where you benefit, of course, getting rid of those coal-fired power plants will, in the Ohio River Valley, will increase health benefits. You can see the darker the blue, the higher the benefit. On-road vehicles, get those off the road. A lot of places, even California, benefit. And looking at the oil and gas production down in the South. So the other sector, very briefly, transportation. U.S. cities that have the highest rates of walking and cycling for work have lower obesity and diabetes rates. But, exercise is more than just burning calories. Contracting muscles are chemical factories for anti-heart disease and cancer chemicals. So you can see other health benefits. And when you look at this image from Portland, we have to make sure that when we have more and more of these great designs for designing cities for people, not just for motorized cars, that it's done equitably. And when we look at the major achievement of getting this climate legislation, the Inflation Reduction Act, which has $370 billion over the next 10 years allocated towards climate action, that there within this is this just 40 initiatives working toward the goal that at least 40% of the benefits from the programs flow into disadvantaged communities. So if you're designing bike trails, make sure it's not just in wealthy communities. So we need to be thinking in that way. And I'll end by just saying that we've been pushing this message into the international arena. We've developed health and equity criteria. We're actually underway trying to formalize those through some research. But you can see a whole list of actual policies in the energy sector, food and agriculture, and transportation that have health and equity benefits, and they are politically feasible. And I think that, this narrative, pushing that forward, could move policy faster and further. And this went into the global climate agreement and in the global stocktake at the Conference of the Parties in Dubai. Of course, my last slide, I have to remind you that through Victor Zal's leadership, National Academy of Medicine has started a grand challenge on climate change, human health, and equity. The Decarbonizing the Healthcare Sector Action Collaborative has made great gains already. CMS has responded. I'm sure John Balbus will be talking more about that. And then a second initiative I've been more directly involved with is this roadmap for transformative action to achieve health and equity at net zero emissions. And this is in process, and it's a health in all policies. Energy, transportation, and food systems those policies are health policies. So in conclusion, if our intervention for resilience against climate risk and efforts to mitigate fossil fuel emissions consider equity, our climate actions will be more just and more lasting. So with that, I thank you for your attention. And again, regards from Australia. Thank you for allowing me to present to you, and good luck with the rest of the meeting in Washington. Take care.